Have you ever stopped to consider how certain parts of your body, your feet, armpits, inner thighs, and back, play a pivotal role in your overall health and vitality, particularly as you grow older? Imagine if I told you that dedicating just a few minutes every day to properly caring for these often neglected areas could have a profound impact on your energy levels, immune function, and help you lead a more vibrant, active life well into your 70s and beyond. You may be wondering why these specific areas are so crucial for maintaining health as you age. Well, after more than 6 decades of experience in the medical field, I can confidently say that paying attention to these 4 key body parts isn't just about basic hygiene. It's about unlocking a secret to better circulation, improved sleep, enhanced mental clarity, and overall healthy aging. The best part? You don't need to devote hours of your day to see the benefits. Spending just 5 minutes each day on each of these areas can make a remarkable difference. So why should you stick around and watch until the end of this video? If you're looking to feel more energized, reduce aches and pains, or simply feel better in your body as you grow older, the simple techniques I'll be sharing can help you achieve just that. These aren't just hygiene tips. These are proven strategies that can boost your vitality and well-being. From preventing common health issues like foot pain and arthritis to supporting your brain health and boosting your immune system, the advantages are wide-reaching and impactful. By the end of this video, you'll have a clear, actionable plan to improve your health without needing extra time or complicated routines. You'll gain an understanding of the science behind these simple practices and how they can create lasting improvements in both your physical and mental well-being. So, stay with me, and let's begin this journey together towards a healthier, more vibrant version of yourself. Before we dive in, I encourage you to subscribe and click the notification bell so you never miss out on any new content. Your support means a great deal to me, and if you enjoy this video, you can help me continue sharing valuable tips by liking and sharing it with others. And if you like the topic we're covering today, please leave a 1 in the comments. If you don't, leave a 0 and share your thoughts on how I can improve. I always appreciate your feedback. Now, let's get started. The human body is an incredibly interconnected system. Imagine it as a network of roads and highways, where certain parts act as critical intersections, influencing the health of the entire system. Among these, there are 4 specific areas that, when properly cared for, can greatly impact your overall well-being. These areas are surprisingly easy to maintain, and with just a few minutes of attention every day, you can see vast improvements in your energy levels, immunity, and vitality. The 4 key areas I'm referring to are the feet, armpits, inner thighs, and back/scalp. Why are these areas so essential? It's not just about cleanliness or hygiene. These areas are home to major blood vessels, lymph nodes, and nerve systems, critical components of your body's internal network. It's no exaggeration to say that the condition of these areas can directly affect your overall health and well-being. If you want to live vibrantly past the age of 75, paying attention to these 4 areas is essential. Many of us have come to accept wrinkles, gray hair, and joint pain as inevitable signs of aging. But based on my 60 years of experience in the medical field, I can tell you that these symptoms can be greatly improved with proper care and attention. It's never too late to start caring for your body. The older you are, the more noticeable the positive effects will be when you begin. So, let me walk you through the 4-part care routine I've developed and honed over 6 decades of working in medicine. We'll start with your feet, the remarkable body part that carries you through every step of your day. How much do you value them? I'll never forget when 78-year-old John Baker came to my clinic, unable to walk without pain. "Doc," he said, his voice trembling, "my legs hurt so badly that even going to the bathroom feels like torture. I feel like my life is over." His eyes welled up with tears as he spoke. When I examined his feet, they were covered in thick, hardened calluses. The skin was dry and cracked, and between his toes, there was visible inflammation caused by moisture and bacteria. I asked him, "How do you take care of your feet, John?" He replied, "Take care of them? I just washed them. And therein lay the problem. We often think that simply washing our feet is enough. But in reality, feet are much more than just tools to help us walk. They contain over 7,000 nerve endings, all of which are directly connected to our internal organs. In Eastern medicine, this connection is referred to as meridians, and interestingly, Western medicine is starting to recognize this link as well. I often tell my medical students, your feet are like your second heart. The muscles and blood vessels in your feet play a critical role in pumping blood throughout the body, supporting heart health, and even affecting your overall circulation. Remarkably, taking care of your feet can improve your cardiovascular health, stabilize your blood pressure, and even enhance your sleep quality. So, how exactly should you care for your feet? After 60 years of research and practice, I've discovered some simple, yet highly effective steps that can dramatically improve foot health. First, begin by soaking your feet in warm water for about 30 minutes. The ideal temperature is around 104 degrees Fahrenheit 40 degrees Celsius, slightly above your body temperature. Be careful not to make the water too hot, as it can damage your skin. Soaking for 30 minutes helps dilate the blood vessels in your feet, promoting better circulation throughout your entire body. I recommend adding a handful of salt to the water, as it's even more effective at reducing swelling. This will help relieve the fatigue built up in your feet over the day and quickly reduce any leg swelling you might be experiencing. This is especially beneficial for those with diabetes or high blood pressure. Take the case of 78-year-old Emily Johnson, who had struggled with insomnia for 20 years. She tried every treatment but nothing seemed to work, until she started soaking her feet every night. Emily shared with me, "At first, I thought, how could soaking my feet make a difference? But after just a week, it did. For the first time in 30 years, I slept deeply without medication." Second, gently massage the soles of your feet. The soles contain reflex zones that are directly connected to your internal organs. By massaging these areas, you stimulate organ activity and boost your health. I make it a point to massage my feet every morning when I wake up and every night before I go to bed. I use my fingertips to massage in gentle circular motions, focusing on the heels, between the toes, and the balls of my feet. One of my patients, a man named Peter, had struggled with severe constipation for 15 years. After incorporating this foot massage into his daily routine, he found relief in just a few weeks. Just 5 minutes a day can improve digestion and help you sleep better. Third, thoroughly clean and dry between your toes. This is a step many people overlook, but it's crucial. The spaces between your toes are damp and dark, perfect conditions for bacterial growth. If left unchecked, this can lead to infections that can impact your whole body. Make it a habit to carefully clean between your toes with a soft towel or cotton swab, and dry them completely afterward. This step is especially important for individuals with diabetes. Take the story of 82-year-old Frank Thompson, who came to my clinic with a painful infection that began as athlete's foot between his toes. The infection got so bad that he was close to needing a toe amputation. Thankfully, with proper care and treatment, Frank recovered. But had he taken better care of his feet, he could have avoided all that pain. If you are still watching this video and find these lessons useful, please comment 1 below to let me know that you are still here with me. Fourth, always moisturize your feet and wear non-slip shoes. As we age, our skin becomes drier and more sensitive, and that includes the skin on our feet. After bathing, apply a moisturizing lotion or dedicated foot cream to keep your feet soft and hydrated. I also recommend wearing non-slip slippers even inside your home. Walking barefoot on hard floors can lead to unnecessary strain on your feet and joints. In my experience, for people over the age of 70, wearing proper footwear can reduce foot and knee pain by more than 30%. Take John's story. He's a 76-year-old man who diligently followed these 4 steps for 3 months. The result? John said, "Dr. Williams, it's a miracle. I wake up now without foot pain. Just last weekend, I walked around the neighborhood park with my granddaughter, something I never thought I'd be able to do a year ago. It's never too late to start. Foot care is more than just hygiene. It's the foundation of your overall health. Will you start taking care of your feet tomorrow morning? Next, I want to talk to you about armpit care, an area that many of us neglect. Why is it so important for immunity, and how should you take care of it? Let's dive into that. Take a deep breath in and out. Do you think of your armpits as just a place for sweat to gather? Well, after 60 years in the medical field, I can tell you that your armpits are your body's natural detox center. Let me share the story of 75-year-old Susan Miller. For over 20 years, Susan battled seasonal bronchitis and allergies. Every spring and fall, she'd visit the hospital for antibiotics and steroids. "Dr. Williams," she said, "taking antibiotics every season became my routine. I thought I'd have to depend on them forever." When I examined her armpits, I noticed the skin was irritated, red, and her sweat glands were clogged. Her lymph nodes were slightly swollen and hard, too. Did you know that your armpits contain over 20 vital lymph nodes? These lymph nodes play a crucial role in your immune system, helping remove toxins from your blood and producing white blood cells to fight infections. These lymph nodes in your armpits are a crucial part of your immune system, helping remove toxins from your blood and producing white blood cells that fight off infections. Unfortunately, most people treat armpit care as nothing more than controlling body odor. They rely on strong perfumes or commercial deodorants, aiming to block sweat glands. But here's the issue. Your armpit sweat glands are a vital pathway for expelling toxins. When you artificially block them, it causes toxins to build up in your body. On the other hand, if you do nothing at all, bacteria will thrive, and an unpleasant odor will develop. So, what's the right way to care for this important area? Let me share a 4-step armpit care routine that I've developed over the years. First, always wash gently with an unscented, mild soap. Harsh chemical body washes or deodorants can disrupt the natural balance of your armpits. For over 60 years, I've always recommended natural, gentle soaps to my patients. To begin, wet your armpits with warm water, and gently wash in circular motions using a mild soap. It's important to avoid scrubbing too hard, as this can irritate the skin and upset the balance. I suggest soaps containing ingredients like green tea or coconut oil, which soothe the skin while naturally fighting bacteria. Second, ensure you dry your armpits thoroughly after showering to prevent bacterial growth. Your armpits are warm and moist, perfect conditions for bacteria to thrive. After showering, use a soft towel to dry them completely. For extra care, I recommend using a hairdryer on the cool setting to ensure that your armpits are fully dry, reducing the risk of bacterial growth. Take 83-year-old John Miller, for example. He had struggled with armpit odor and itching for over 20 years. But after implementing this simple step, he noticed a dramatic improvement. Third, opt for natural deodorants made from simple, safe ingredients. Avoid deodorants containing aluminum or parabens, as these ingredients clog sweat glands and can disrupt lymph node function over time. For more than 6 decades, I've personally used a natural deodorant made from a mixture of baking soda and coconut oil. This combination effectively neutralizes odor while allowing your sweat glands to function properly. Another great option is to dilute apple cider vinegar with water and apply it to your armpits. The vinegar smell fades quickly, and it naturally balances your skin's pH level. Fourth, incorporate a 2-minute morning lymph massage to boost circulation. This is one of the most important steps I emphasize to my patients. Spending just 2 minutes each morning gently massaging your armpits in circular motions can significantly enhance lymph circulation and promote toxin removal. The technique is simple. Raise one arm overhead and use your opposite hand to massage in circles from your neck down toward your chest. Spend 1 minute on each side, totaling just 2 minutes. Let me tell you about 75-year-old Sarah Thompson. She experienced remarkable changes after following these 4 steps for just 2 months. Sarah said, "Dr. Williams, I can't believe it. For the first time in 20 years, I got through fall without bronchitis. No antibiotics. It's like a miracle." Remember, your armpits are not just about hygiene. They're an essential part of your body's natural detox system. Start caring for them properly today, and you'll experience significant improvements in your immunity and toxin removal. Now, let's talk about another overlooked area, your inner thighs. Why is this area so crucial for blood circulation and liver health, and how can you care for it? Let's explore. Take a moment to place your hand on your inner thigh. Can you feel a pulse? That's where major blood vessels and lymph nodes are concentrated. In my 60 years of treating patients, I've observed something remarkable. The health of your inner thighs is directly tied to both liver function and overall blood circulation. Let me share the story of 71-year-old Linda Harris. Linda had been suffering from leg swelling and numbness every night, unable to sleep without medication. "Dr. Williams," she said, "my legs cramp every night. I can't sleep. I've been to several doctors, but none could figure out the cause." When I examined Linda's inner thighs, her skin was dry and cracked, and the lymph nodes in her groin were slightly swollen and hard. We ran blood tests, and sure enough, her liver values were slightly elevated. Your inner thighs are much more than just skin. They play a vital role in your overall health. Your inner thighs house the femoral artery, veins, groin lymph nodes, and other essential circulatory structures. Poor circulation in this area can lead to problems like leg swelling, varicose veins, and even negatively impact liver function. In Eastern medicine, this area is considered a key pathway for the liver meridian. And interestingly, Western medicine now recognizes that the lymph circulation in your inner thighs is closely linked to liver detoxification functions. So, what happens if you neglect your inner thighs? Blood circulation slows down, toxins begin to build up, and that can lead to chronic fatigue, swelling, and even affect liver health. Now, let me share with you the inner thigh care methods that I've researched and practiced over the years. First, wash gently with warm water and mild soap. Many people overlook proper cleaning of their inner thighs, especially as we age and our bodies become less flexible, making it harder to reach certain areas. Start by wetting your inner thighs with warm water and gently washing them with a natural, mild soap. It's important to avoid harsh chemical body washes that can damage the delicate skin in this area. I often advise my patients to use a bath sponge or a soft towel wrapped around a stick so they don't have to bend too much while cleaning. Second, wear breathable cotton clothing after washing. The skin around your inner thighs is prone to moisture and warmth, which can lead to irritation and other skin issues. After showering, dry the area thoroughly with a soft towel, and make sure to wear cotton or linen underwear that allows the skin to breathe. As we age, it's essential to avoid synthetic fabrics like polyester or nylon because they don't absorb sweat and can irritate the skin. I recommend loose-fitting, 100% cotton underwear for optimal comfort and circulation. Tight underwear can restrict blood flow and lymph circulation, which can exacerbate problems. Take the case of 76-year-old Robert Sanders, who had struggled with severe skin irritation in his inner thighs due to tight underwear. After switching to loose cotton underwear, Robert saw dramatic improvement within just 2 weeks. Third, do simple stretches like the butterfly pose to improve circulation. One of the best ways to promote blood flow to your inner thighs is through stretches like the butterfly pose. To perform this, sit on the floor, bring the soles of your feet together, and gently lean forward, moving your knees up and down to loosen your inner thigh muscles. If that's difficult for you, try this easier option. Lie on your bed, bend one leg, and lower your knee to the side to stretch your inner thigh. At 91, I still practice this simple 5-minute stretch every morning. It helps keep my blood and lymph circulating, which leaves my legs feeling light and energized throughout the day. Finally, apply moisturizer or powder to prevent skin issues from friction. As we age, our skin becomes thinner and more prone to dryness, especially in high-friction areas like the inner thighs. After showering, I recommend applying a natural moisturizer like Vaseline or coconut oil to keep the skin soft and hydrated. In the summer months, you can also use a light dusting of cornstarch powder to reduce friction caused by sweating. Just ask 71-year-old Margaret Taylor, who followed these 4 steps for a month. She experienced amazing results. Dr. Williams, I can't believe it. My legs don't cramp at night anymore. I'm sleeping without medication, my swelling has gone down, and my liver values are back to normal. Your inner thighs are much more than just skin. They're crucial for healthy circulation and liver function. Start caring for this area today, and you'll notice significant improvements in leg swelling, chronic fatigue, and overall liver health. Next, let's move on to back and scalp care, 2 areas that are often overlooked. Why are these so critical for brain health and nervous system function, and how should you care for them? Let's explore. Have you ever thought that fatigue and memory decline are simply part of the aging process? Well, that doesn't have to be the case. Take the story of 75-year-old Helen Roberts, who noticed her memory was slipping and she felt constantly fatigued. She feared it was the onset of dementia. Dr. Williams, I keep forgetting my grandchildren's names. Is this the beginning of dementia? I'm so scared, she told me. When I examined her back and scalp, I found tight, stiff muscles, a dry scalp, and noticeably reduced blood circulation. As I suspected, these issues were contributing to her mental and physical fatigue. These areas of your body aren't just places to wash. They're deeply connected to your central nervous system and play a crucial role in supplying blood to your brain. Medically, the muscles in your neck and upper back directly impact the blood vessels and nerves that lead to your brain. When these muscles become tight, it reduces blood flow to the brain, which can negatively affect memory and cognitive function. The scalp is just as important. Its health is directly tied to brain health. Poor circulation in the scalp reduces the nutrient supply to your brain, impairing cognitive abilities and overall brain function. Now, let me share the back and scalp care techniques that I've researched and practiced throughout my career. First, wash your back with lukewarm water and use a soft brush. Most people don't properly clean their backs, especially as we age and our flexibility decreases, making it harder to reach certain areas. I recommend using a long-handled soft bath brush. Wet your back with lukewarm water, and gently brush in circular motions from your spine outward. This method improves circulation, loosens tight muscles, and helps boost blood flow to the brain, leaving you feeling more clear-headed. 79-year-old George Harrison, a longtime patient of mine, shared, "After doing this, even a simple shower makes my head feel clearer." If you are still watching this video and find these lessons useful, please comment 2 below to let me know that you are still here with me. Second, scalp massages are an excellent way to improve blood flow to your brain. Scalp massages have a remarkable effect on brain health because your scalp contains countless blood vessels. By massaging the scalp, you directly enhance circulation to the brain. I make it a habit to massage my entire scalp with my fingertips every morning and night. It's a simple practice. Use your fingertips to gently massage in circular motions for 5 minutes. Avoid pressing too hard. When shampooing, take the time to massage your scalp gently, paying extra attention to the back of your head and your temples. These are key areas where major blood vessels leading to the brain pass. 75-year-old Susan Rogers said that after just 2 weeks of doing this, her mind felt clearer and her memory improved. Third, simple morning stretches are essential for keeping your spine flexible. Your spine is the highway for your nervous system, and its flexibility directly affects nerve transmission and blood flow throughout your body. At 91, I still perform 5-minute spine stretches every morning. It's easy. Sit on your bed, gently turn your head side to side, then forward and back. Afterward, roll your shoulders and gently bend your upper body from side to side. If that's too difficult, here's an easier option. Lie on your bed, bend your knees, and gently lift and lower your hips to maintain flexibility in your lower spine. 83-year-old Thomas Green, a longtime patient, saw significant improvement in his chronic back pain after just 1 month of doing these stretches. Finally, a 5-minute evening massage helps you sleep deeply. A back and neck massage before bed is a great way to relax your central nervous system and relieve tight muscles along your spine, promoting deep, restorative sleep. It's simple. Apply massage cream or oil and gently massage from your neck to your lower back, focusing on loosening your neck and shoulders. If you're unable to do this on your own, place 2 tennis balls in a sock, lie on them, and roll slowly. This will help relieve back tension effectively. 75-year-old Helen Smith saw dramatic changes after 2 months of using this technique. Dr. Williams, it's a miracle. I don't mix up my grandchildren's names anymore. My mind is clearer, and I feel full of energy. My family says I've completely changed. Your back and scalp aren't just areas to wash. They're vital for your brain health and nervous system function. Start caring for them now, and you'll experience noticeable improvements in memory, cognition, and overall vitality. Now, let me show you how to incorporate all these care methods into your daily routine. We've covered 4 essential body parts for health: feet, armpits, inner thighs, and back/scalp, and I'm sure you're thinking, that's a lot to manage. How do I keep track of it all? Don't worry. With my 60 years of medical experience, I've found the most effective and sustainable ways to make this easy to implement into your life. Let me introduce the 5-minute miracle for building healthy habits. The key is not trying to change everything all at once. Small, gradual changes are the most effective and sustainable. Here's a simple approach. Dedicate 1 day a week to focus on a specific area of care. For example, Monday can be foot care day, Wednesday can be armpit care, Friday for inner thigh care, and Sunday for back/scalp care. On the other days, stick to basic hygiene. This method allows you to focus on one area at a time, making it easier and less overwhelming. Second, spend just 5 minutes per area. 5 minutes is a small amount of time that anyone can find in their day. As a 91-year-old practicing doctor, I can tell you the greatest health secret isn't about doing something grand or complicated. It's about consistently practicing small habits. I start every morning with a foot massage, do a 5-minute thigh stretch after meals, and focus on back brushing and scalp massage during my evening shower, all in less than 15 minutes a day. Third, tie these new habits to your daily routine. Linking them to existing habits ensures they stick. For example, you can massage your feet while having your morning coffee, stretch your thighs while watching the news, brush your back and massage your scalp during your shower, and perform an armpit lymph massage before bed. This eliminates the "I don't have time" excuse. Finally, believe in the power of small changes. "It's too late" is a common misconception. In over 60 years of treating elderly patients, I've witnessed the most remarkable transformations in those who began practicing these habits in their 80s and even 90s. 86-year-old Patricia Allen reduced her blood pressure medication and overcame 10 years of insomnia after just 6 months of using these methods. Dr. Williams, I can't believe how healthy I feel in my mid-80s. I look forward to my mornings now. 93-year-old James Taylor went from struggling with chronic pain to walking without a cane, thanks to these simple practices. They say it's never too late to learn. I didn't know health practices could be this effective. Walking in the park with my grandchildren has become one of my greatest joys. We've covered a lot today, from the importance of caring for key areas of your body like your feet, armpits, inner thighs, and back/scalp, to practical steps you can start incorporating into your daily routine. Now that you've learned these simple yet powerful techniques, I'd love to hear from you. What is one thing you've learned today that you plan to put into practice in your own life? Please leave your thoughts in the comments below. I'd love to know what resonated with you the most. If you enjoyed this video, please take a moment to leave a comment, and don't forget to like, share, and subscribe to our YouTube channel for more valuable tips. Your support helps us keep spreading knowledge and empowering people to live healthier, more vibrant lives. Thank you for watching, and I'll see you in the next video.